Namaste. Welcome to Heartbeat episode. Nowadays, sudden death is one of the reason, and this question is coming time and again on the social media. And not only that, it has been asked in the Parliament from the Health Minister. What is the incidence? Why it is happening more? And whether corona or corona-related vaccine is the cause or not. So first, let us know what sudden cardiac death is. So any witnessed death within 1 hour or unwitnessed death within 24 hours means the person to whom you have seen within 1 hour he died, and there is no direct cause for the we are able to see, or the person who has been seen 24 hours back, he was doing fine, and you are seeing next day he's died. It is called sudden cardiac death or sudden death. And there, if it is related to cardiac, we say sudden cardiac death, and it needs post-mortem for before uttering or before establishing it, because sometimes we are suspecting it is a cardiac, but it may be some other causes also, and it need a molecular diagnosis or molecular post-mortem on that ground, that whether any particular disease is there underlying, and that is causing the sudden death. Now, why it is happening nowadays so commonly it has been reported that young patients are having heart diseases which are having no risk factor, teetotalers. Even one doctor who recently died, and everybody started beating their brain that probably it was the stress or he was not taking particular rest, that's why he died. So unless or until we are not knowing the fact, we should not come and on the media and give the evidences. Unless postmortem is not done, nobody can claim why it is happening. And a lot of things over the time compounds before the heart attack, or you can see cardiac arrest happens. Cardiac arrest is one of the conditions where the electrical failure happens. Means all of a sudden heart electricity problem which present as an arrhythmia, heart beating may be going very fast or very slow happens in a particular type of diseases. So there are, we can say, underlying heart conditions are there which may not get evaluated or which may be running in the family, and that may be cause of sudden cardiac arrest. But what happens, some patient who is chest pain, ECG showing particular heart attack findings, and when they are being transported from their home, they die in the way, or they are not able to reach to the hospital. And there again, the electrical problem is one of the cause for it. So if the patient develop cardiac arrest or patient develop arrhythmia and later on cardiac arrest, he can die. So cardiac arrest is a condition, or we can say arrhythmic condition, in which the patient can die within seconds. And the only one tool is there which can revive the patient, that is called CPR, cardiopulmonary resuscitation. So this is, if somebody is saying that person has died in the family or in the locality, I think the awareness of CPR and training of CPR is more important than giving the reasons behind the vaccine or some other reasons. So let us learn CPR, what CPR is, from a trained person, and protect the life of the person who develop cardiac arrest or who develop heart attack followed by the life. So sudden death is one of the important thing which happen in a particular subset of the patient who are having a background disease which may be going, which needs not only ECG, echo and angiography, sometimes genetical evaluation, and after establishing only we can protect those type of patients. Sometimes it is very difficult to diagnose those particular condition by the tools available in common practice. So usually the sudden cardiac death evaluation goes in the domain of electrophysiology, because it is the electrical problem, and we have to see from that angle also if other investigations turn out to be normal. So if anybody is having a sudden cardiac arrest in the family, it is good that you should go to the cardiologist, but it is best if you can meet an electrophysiologist and discuss the problem, what has happened to the patient. And those battery of tests sometimes give some insight regarding the cardiac arrest, what has happened, and whether any gene is responsible, and whether we can change by the lifestyle or the drugs or devices. Thank you so much. See you next time with a new information. Namaste.